Hello everyone, I'm Ritu and I'll be talking about my elective experience, and I'd just like to say a huge thank you to the York Medical Society for their bursary, which has made this experience possible. So before I start, I thought I'd talk a little bit about me. So I'm a fifth year medical student at CAMHS and I'm also estranged from my family. I work in a bar part-time and I also tutor and do flexible hospitality work. As a result of my estrangement, I incur costs such as paying rent for longer periods of time than expected due to not going home for the holidays. And this funding has enabled me to spend more time on my elective and engage in out-of-hours shifts and complete a project on transition from child to adult services. I have a keen interest in psychiatry and I'm a part of the CAMHS PsychSoc committee as the social media officer. So I chose to do my elective in the Department of Community Paediatrics at Hull University Teaching Hospitals. I would like to work in the Yorkshire area following graduation, so I felt that an elective in Hull would be beneficial. I also have a keen interest in psychiatry, so I felt that working in CAMHS and outpatient clinics would also be beneficial as well. I spent some time with a local charity called TIC Yorkshire, where I gained valuable insight into Tourette's, ADHD, and other neurodevelopmental conditions. And during my elective, I produced a leaflet under the guidance of my supervisor, Dr. Hannah Townsend, who's a consultant paediatrician and a HIMSS alumni. This was an informational leaflet on transition guidance from child to adult healthcare services. So I spent time on the paediatric wards, so I had the opportunity to clerk some patients and take some histories from parents and children themselves in a variety of different environments, such as the wards as well as inpatient units and outpatient clinics. So I had a wide variety of experience within paediatrics. So I produced a leaflet on transition, and transition is the purposeful and planned process of supporting a transfer of a young person's healthcare from child-centred to adult-orientated services. It was made to be non-speciality specific and to encourage useful conversation between children and their healthcare providers. My leaflet covered various topics to encourage conversation and thoughts about how transition may look for each young person. I reviewed and edited my leaflet to include sections about considering employment and university with a health condition, what to expect from transition, top tips about transition, such as asking your team or healthcare provider about what it will look like for you. And as well as that, I talked about a health passport within my leaflet, which is a document which can help a young person to remember and explain key parts of their health condition and care, such as diagnoses, past procedures, surgeries, family history, medications they take, and keeping track of all their upcoming appointments. I also produced an easy read version of the leaflet for young people with learning disabilities. So how my elective has shaped my career aspirations. So my elective has really reinforced my interest in psychiatry and has also reinforced that I would really like to pursue a career in Hull during my foundation years. And thank you for listening.
Thank you. I'm going to put somebody on the spot here. Barry, or has he just gone out? He's gone out to get the pizzas. Okay. The person holding the pizzas tonight is a professor in child psychiatry, so who's retired. So you must meet him afterwards. But have we got any questions? I'd like to start with Matt.
That was really interesting. The transition, so I used to run a transition clinic in Birmingham. There needs to be lots and lots, as kind of input into.
Do you want to come up, because I want to, because I've just realised.
Shout, would that help? Does that have to be much louder?
Come on up. Yeah, it's easier. And I keep forgetting to, there's a long question, I keep totally forgetting to.
So what I was saying was, I used to run a transition clinic in Birmingham for kids with kidney disease. And you're absolutely right, it's a really high risk time of their life, particularly people with chronic diseases and needs lots of input. But the other bit that always struck me was the support that the parents need around children transitioning towards adulthood. And that was the bit that I wasn't sure we always did very well. You'd spend half your life trying to persuade the kids to take some responsibility and let the parents back off a bit and allow the kids. And I just wondered if you'd thought about that or had any reflection on that from your experience on your elective.
Yeah, so when I was on my elective, I saw that a lot of parents had a lot of concerns about how they weren't going to be able to be as involved in their children's healthcare, because a lot of appointments, once you reach the age of 18, they won't really tell the parents anything, and it all has to go through the child. And if the child isn't as forthcoming with information or isn't as on top of their healthcare as the parents were, then things can slip through the net. So there were concerns about that, and we tried to put a bit about that in the leaflet, about how children and parents need to have that communication with each other and with their healthcare providers about what they will do once the child reaches 18.
What's another question, Jim?
You sort of answered my question, because I was going to say what age does transition, but does it occur? But would it be different in different specialties? As you said, it's not specialty specific, and also it must vary from individuals as well. You know, somebody will be ready to transition because some people grow up faster than others. Any comments on that?
So the process of transition is more of a process rather than like one specific event. Like as soon as you turn 18, everything changes, but within different healthcare providers, different localities, and sort of like a postcode lottery, which places do things at which ages. So it's all very variable in how it's run.
Are you getting this into different languages as well, your leaflet?
We haven't discussed that, but it would be a good idea, yeah.
Any other questions? Barry, who's all right, who's now just come back in for the pizzas.
I guess one of the biggest challenges for transition is the massive cultural differences between children's services and adult services. So paediatricians are very holistic and they look after all the systems, but when kids hit adulthood, they then go to all the subspecialties. So if you have a complex disorder, you go from seeing one team to seeing multiple teams. CAMHS, similarly, is very focused around prevention, and adult mental health services are really focused solely around severe and enduring mental illness, so very different culturally. I mean, I just wonder what your experience was of those big differences in cultures between the teams when you're making those transitions.
Yeah, I agree. I think one of the big problems which comes with transition is that when children often move from child-centred services to adult-orientated healthcare services, there isn't often an exact match-up, so there isn't a service that is directly similar to what they were experiencing, and sometimes there isn't a service at all for them to go into, so they're often left back into the care of their GP, who might not be equipped to deal with the complex conditions that they have. So a lot of children do slip through the net.
Yes, I think that you had a question, didn't you?
Thank you very much. I hope the Society will circulate the slides and perhaps a copy of your leaflet. I don't know whether it'd be most interesting to have a look at it.
Yeah, definitely. I could send over a
The
copy
comment
of the
there was
leaflet.
that it would be nice to have a copy of the leaflet circulated, so we will see what we can do. Yes. Any other questions?
Maybe with problems with capacity, aren't there, in the NHS? Did you notice any significant differences when people transitioning from the paediatric services to adult services with difference in capacity, so that they're waiting a long time in order to transition because there isn't capacity to take them?
So with mine, I did a lot of work in psychiatry and eating disorders and CAMHS. So the services had different criteria for who they'd accept. So sometimes, whilst they would be under a CAMHS eating disorder team, they wouldn't necessarily fit the criteria to receive care from an adult eating disorder team, or there'd be long waiting times. So when young people who are, say, 17, they would start off in CAMHS, but they wouldn't really receive much help. And by the time they turned 18, they'd be rejected from CAMHS anyway. So there's a lot of disparity there.
I think a comment that was made earlier was about the parents, because certainly when I was doing the obstetric diabetes and you suddenly got this girl who was just coming out of paediatrics, got pregnant straight away, ending up in our clinic, and then where you've got to leave the children's diabetes, you've got to now be in the maternity and also the adult one. And occasionally the parents would come along, and the difficulty we would have with them, well, not only because she was pregnant, so that's one thing, but also they wouldn't accept that she should now have adult services. I think it would be a really good idea, just subtly doing a leaflet that subtly tells the parents how they should. I think that was a brilliant idea, and almost better than just the children as well, isn't it? Because that really is a problem. We had terrible problems with them, and they'd want them to go to paediatric wards instead of the obstetric wards.
The paediatric obstetric ward.
Well, in some cities they probably do have them, not in York. That was very interesting. Thank you.
Thank you.
Thank you. Right. I'm now going to, we've had